Dasman Diabetes Institute, the DDI, opens a new ENT, that's ear, nose and throat clinic, to diagnose and aid diabetic patients with obstructive sleep apnea under the umbrella of KFAS, that's Kuwait Foundation for Advancement of Sciences, with the direct supervision and guidance from Sabah Al-Ahmed Center for Giftedness and Creativity. The Kuwaiti Consultant, Dr. Abdulmohsen Al-Terki, invented a new application and classification to help patients to be better diagnosed and treated in the area of the upper airways obstruction, causing snoring that develops in more health complications and diseases. Salim Al-Kendari has the details in this report.
Dasman Diabetes Institute opened a new clinic that can improve better diagnosis and treatment for patients with obstructive sleep apnea. The new protocol, invented by the Kuwaiti Consultant, Dr. Abdulmehsin Al-Turki, will set the standards globally for doctors to follow for the diagnosis and treatment of the problem.
It gives me great pleasure today to announce that we are opening a clinic for sleep apnea, together with collaboration with the Sheikh Sabah Center for Creativity and Giftedness. Dasman Center is very proud of opening this clinic. This is related to diabetes type 2, especially with obese people who have sleep apnea, and it causes a lot of social problems. Therefore, I think the center is vital for Kuwait because diabetes in Kuwait is very prevalent, and the Dasman Center is very proud to open this specialty.
We are looking at the sleep apnea, which is one of the issues in Kuwait, mainly in type 2 diabetes people do have. As you probably know, there were 300,000 Kuwaitis, they have the type 2 diabetes. Now the problem is, in addition to diabetes type 2, they have snoring at night. And this is something that we want to fix it in order for they have a better life, better family life, and they can sleep better, and so on. So we are opening the first clinic in Dasman now, and we are hoping to see how we can help the people in Kuwait in order not to snore at night. The family condition would become better, and they will become better also themselves as doing this. And I think that's the beginning of what we can help for the diabetic patients in their life and their life at home.
In March 2013, I got a patency to diagnose and treat patients with snoring and obstructive sleep apnea through a 15-point mechanism. And today, this is a special day for me because we're opening a ENT clinic at Dasman Diabetes Institute, which is a very unique opportunity because we found out that patients who have diabetes, especially type 2 diabetes, the problem with them that almost 80% of them will have issues with breathing, and mainly what we call it obstructive sleep apnea.
Obstructive sleep apnea can affect up to 4% of the population, where 80% of the patients do not know they have such a problem. It is a slow process that can start with just simple snoring, but can lead to fatal disease affecting the heart and the brain due to the lack of enough oxygen while asleep.
In cooperation between KFAS and Sabah Al-Ahmed Center for Giftedness and Creativity, Dasman Diabetes Institute had opened a brand new clinic that deals with sleep apnea disorders and the treatment for such problems. From Dasman Diabetes Institute, this is Salim Al-Kendari.